You've been lied to your entire life. They told you masturbation was dirty. They told you it was something you should have outgrown by the time you turned 50. They told you it was childish, shameful, and definitely not something a grown man should be doing. But here's what no one ever told you. After 60, masturbation isn't just normal. It could be the difference between living fully and slowly declining. It could be the difference between feeling alive and feeling like you're just waiting for the end. Hi, I'm Dr. Nerita, a urologist with 12 years of experience specializing in men's health. And today, I'm going to share 7 powerful science-backed masturbation secrets that every man over 60 wishes he had known sooner. These aren't theories. These aren't opinions. These are biological truths that can transform how you feel, how you function, and how you see yourself. Before we begin, if you believe men deserve open, shame-free conversations about real health issues, take a moment to like this video, subscribe, and let me know in the comments where you're watching from. Your engagement helps me reach more men who need to hear this truth, men who have been suffering in silence for far too long. Now, let's get into it. Starting with one of the biggest mistakes older men make when it comes to self-pleasure. Secret number 1. Mindless masturbation can lead to numbness and erectile dysfunction. I've had hundreds of men walk into my office over the years, shoulders slumped, voices low, and eyes full of quiet shame. When I ask gently, "Do you masturbate?" Most pause, then whisper, "Yeah, but I don't feel much anymore." Or, "I can only finish a certain way." What they don't realize is that their body isn't broken. It's trained wrong. See, mindless, mechanical masturbation, quick, tense, disconnected, teaches your brain a pattern. It's like giving your body a script. Same hand, same motion, same outcome. And your brain, being the fast learner it is, locks onto it. Over time, your sensitivity drops. Your erections fade. You start needing more stimulation, more pressure, or more extreme content just to feel something. That's how porn-induced erectile dysfunction or delayed ejaculation develops. Your brain literally forgets how to respond to real touch and real connection. The emotional cost is massive. You start feeling detached from yourself. You stop reaching for your partner or even your own reflection. Confidence drops. Loneliness grows. But here's the good news. You can retrain your body. Your nervous system can heal. It starts by slowing down, making self-pleasure intentional, not performance-driven. No rushing, no pressure. Reconnect with feeling, not fantasy. Because masturbation isn't the enemy. It's the way you do it that matters. And while mindless pleasure damages, what's even more dangerous is when you stop altogether. Secret number 2. Not masturbating can lead to prostate congestion and inflammation. I once had a patient named David, 68 years old. He came to me saying he was waking up 6 times a night to pee. Pressure, fullness, and a dull ache deep in his pelvis that wouldn't go away. When I asked, "When was the last time you ejaculated?" he laughed and said, "Years ago, doc. I thought men my age were supposed to stop doing that." Here's what I told him. Your prostate doesn't stop working when you stop ejaculating. It keeps producing fluid, and when that fluid isn't released, it builds up. That buildup leads to prostate congestion, inflammation, and discomfort. Your body becomes like a pressure cooker, building pressure with nowhere to go. That's when you start getting symptoms like frequent urination, weak stream, pelvic pain, even risk of infection or long-term inflammation. Yes, chronic inflammation can increase the risk of prostate cancer. In fact, Harvard researchers found that men who ejaculated at least 21 times per month had a significantly lower risk of developing prostate cancer than those who didn't. When David began masturbating again, not out of lust, but out of care for his own body, his symptoms eased. His sleep improved and his spirit came back to life. Men, you wouldn't ignore your heart or your blood pressure, so don't ignore your prostate. It needs movement, release, and circulation. And there's one emotion that makes things far worse. Something that quietly eats away at your mental health, too. Secret number 3. Shame around self-touch damages mental health. I see it all the time. Older men who can't even say the word masturbation without looking down. Not because they're bad men, but because they were taught it was wrong. You grew up in a time when touching yourself was called dirty or sinful, and that shame didn't disappear. It just went quiet. It burrowed deep into your nervous system, shaping your relationship with your body. Here's the truth. Shame is a stressor. It raises cortisol, tightens muscles, and floods your brain with anxiety. And over years, that chronic tension leads to depression, heart disease, immune issues, even dementia. Masturbation, when done consciously, actually releases dopamine, oxytocin, and endorphins, the body's natural antidepressants. It improves sleep. It supports emotional regulation. So when you avoid self-touch out of shame, you're not just denying pleasure, you're denying healing. One of my patients, a 72-year-old widower, hadn't masturbated in over a decade. He wasn't sick, but he was numb, lonely, disconnected. We worked together to slowly rebuild his relationship with his own body. And after a few weeks, he laughed again. He started sleeping better. His blood pressure dropped. He wasn't just alive again. He felt alive again. So, hear me clearly. You are never too old to touch yourself with dignity, kindness, and purpose. And if shame can destroy your vitality that deeply, imagine what happens when your hormones start joining the decline. Secret number 4. Testosterone is stimulated by sexual activity, even solo. Most men believe testosterone just drops with age. That's not the full truth. Yes, it can decline naturally, but it plummets faster when you stop engaging with your sexual energy altogether. When you stop touching yourself, your body assumes you don't need that system anymore. It down-regulates testosterone production. Muscles soften, fat increases, energy fades, confidence slips. But here's what's incredible. When you reawaken that energy, when you engage with your body intentionally, your brain gets a signal. He's still alive. He still needs this. That signal increases testosterone, strengthens cardiovascular function, and improves mood. I once treated Frank, a 73-year-old retired firefighter. He told me, "Doc, I just feel like I've slowed down. I don't feel like me anymore." His testosterone was at rock bottom. We worked together. No pills, just lifestyle and connection. Slowly, he started self-pleasuring again, exercising, and sleeping better. 3 months later, he was standing taller, speaking with confidence again. His lab results were dramatically better. Men, your sexual energy isn't just about sex. It's about aliveness. Secret number 5, erections are a use it or lose it system. Your penis isn't just a sexual organ. It's a vascular organ. It's about blood flow, nerve health, and cardiovascular function. If you stop getting erections, whether through sex or masturbation, your body slowly shuts that system down. The smooth muscles lose elasticity. Blood vessels stiffen, oxygen flow drops, and over time, you can lose natural function permanently. Think of it like this. If you stop walking for years, your legs weaken. If you stop having erections, your penile tissues atrophy. Regular erections, even solo, keep blood flowing, nerves responsive, and tissue healthy. It's not about performance, it's about preservation. This one simple act is a natural form of preventive medicine. And if you're wondering what's making it harder to maintain erections, even when you try, there's one modern factor that's rewiring men's brains every day. Secret number 6. Porn changes your brain, but you can take control. Let's talk honestly about pornography. Today's porn isn't like what existed decades ago. It's ultra-stimulating, fast, high intensity, and endless. Your brain was never designed for that level of dopamine flooding. Each click delivers a hit of reward, and over time, your brain stops responding to normal touch. It craves novelty and intensity instead. That's why so many older men tell me they can get hard for porn, but not with a real partner, or not at all. This isn't moral advice, it's biological reality. Your brain is being overstimulated into numbness. But here's the beautiful part, you can rewire it. Your brain remains plastic, even in your 60s, 70s, or beyond. Start with a 30-day detox. No porn, no fantasy, no artificial triggers. Then slowly reintroduce natural touch, imagination, and connection. Within weeks, your body begins to remember how to feel again. You're not broken. You're retrainable. Secret number 7, conscious masturbation can improve longevity and quality of life. When you touch yourself consciously with presence, gratitude, and intention, your whole biology shifts. Your breathing slows, your heart rate stabilizes. Oxytocin and endorphins flood your system, lowering blood pressure and inflammation. This isn't about indulgence, it's about vitality. It's self-care for your nervous system. When men integrate mindful self-touch into their routine, studies show better sleep, lower anxiety, improved circulation, enhanced immune response, and emotionally, it rebuilds confidence. You start looking in the mirror differently. You carry yourself like a man who's alive, not a man waiting for life to end. So, here's your plan, step by step. Ditch shame. You did nothing wrong. You're taking control of your health. Take it slow. Focus on sensation, not speed. Avoid porn. Rebuild your natural connection to your body. Stay consistent. Treat this as part of your wellness routine. Track progress. Notice improved sleep, mood, and energy. Listen, aging doesn't mean disappearing. You still deserve touch, connection, and pleasure. You still deserve to feel vital. You've lived decades giving to others. Now it's time to give back to yourself. So, to every man watching this, you are not broken. You are not done, and you are not too old to reclaim your body. You have the power to restore what time has dulled, to feel alive, confident, and grounded again. If this video spoke to you, leave a yes in the comments. Hit that like button and subscribe for more science-based, shame-free health insights for men over 50. This is Dr. Nerita, reminding you that your health is worth fighting for. Take care of yourselves, gentlemen. I'll see you in the next one.